Alrighty guys, we're going to look into the role of families in healthcare, and this is specifically important for pediatric patients because they are dependent on their families, right? Whether that's mom and dad, grandma, grandpa, aunts, uncles, whoever that might be, the family's role in healthcare is super important. So the family structure and function has an important influence on health, right? They kind of determine how healthy we are, especially in the early stages of life, what we're given to eat, if we're given accessibility to outside play, things like that. A child's physical and emotional health and cognitive social functioning is strongly influenced by how well the family functions. So again, as I said, that family dynamic is so important to how we grow up and our health and well-being when we're children. So there are lots of different theories that talk about how families interact with pediatric patients and how they respond to different health events. But the one we're going to be diving into and looking at is the family health system approach. And it has 5 key areas that we're going to look into. That's the interactive phase, the developmental phase, coping, integrity, and health. And so we're going to look at each of those to better understand this family health system approach and how families and patients interact in these different health events. And to do so, I want to give us a case study to look at. So we're going to look at little Ian Chappell. So he was born a low birth weight infant with a disorder called short bowel syndrome. It's characterized by maldigestion, malabsorption, dehydration, electrolyte abnormalities, and both macronutrient and micronutrient deficiencies. Owing to new medical and surgical treatments, the survival rate ranges from 73% to 89%, so it's pretty good. Ian will, however, require long-term parenteral nutrition. For those of you that don't know that is through usually a central venous access device, so some sort of central line. He will not be able to take food orally and will be dependent on IV solution to provide the bulk of his nutritional needs. Ian is the first child of Dylan and Adriana Chappell, both in their early 30s. After a stay in the NICU, Ian was sent home with his parents, who have provided his care since that time with the help of a home care agency and a nutritional support company. The Chappells do not have any other family members nearby. The majority of Ian's care falls on them. Ian is now 2 years old. He's very active. Miss Chappell is the primary caregiver during the day and most evenings. She works weekends, however, as a nursing assistant at a local assisted living center to supplement some of their family income. Mr. Chappell works as a paralegal in a law firm, and he attends law school at night. The Chappell's insurance coverage is through a group plan at the law firm where Mr. Chappell works. So let's keep this case study in mind as we talk about the different aspects of that family health systems approach. So the first process is the interactive process, and this is looking at the family and how their communication, their relationship, and their social supports work. And obviously, open communication should be encouraged between the family members. In your assessment of the interactive process, what is your assessment of the interactive process for the Chappell family? What will you explore as the medical assistant? What will you ask to understand more about their interactive process? Do they communicate well, right? What types of relationships are going on in their family? What is the quality and the amount of social support that they receive? What do you guys think? We've already learned that they might not see each other very often, right? Dylan and Adriana, the parents, they sound really busy, so that communication might be a little strained. It also sounds like Adriana doesn't really get much of a break, so we may need to refer them to some support groups so they can openly communicate, especially Adriana, since a lot of the care falls on her. There's also something called respite care, which allows caregivers to take a break, right? These respite care workers come in and they allow the parents to take a break that they often need for their own mental and emotional health. So that was the interactive phase, and remember that one is kind of talking about communication and how that family relationship looks and how their social supports are. Now we're looking at the developmental phase or developmental process. Here they're assessing the developmental phase of not only the patient, but also the family. So we know the developmental phase of Ian, he's turning 2, right? So that means he's going to be much more active. He's going to be exploring his environment. He's growing, right? So with that, we need to think about his developmental stages. So with that being more active, he's going to want to move around, right? And if he's tied to an IV pole, that might become difficult. Individuals with short bowel disorder often have more frequent trips to the bathroom, so potty training might be difficult, right? And he's 2, so that's often around the time where that becomes a conversation. But we're also looking at the family developmental stage. And Duval, back in 1977, developed what's called the family life cycle. And here they kind of developed these different stages of the family life. So developmental stages for families, right? So what stage would you think that the Chapels are in right now? And we're looking over here at this family life cycle image. They're in those childbearing families, right? The oldest child is from birth to 30 months. So he's 24 months, so 2 years. So they're still in that childbearing age range, right? And that's important to know because they don't have older children, right? They haven't gone through this before. They're not that new married couple, right? They have more obligations and they have new experiences and things. So it's important to not only look at the individual's developmental area stages, but also the family stages. And then the coping process. So coping has been identified as problem solving, adaptation to stress and crises, and the management of different resources. Coping helps us lower our anxiety so that we can meet the demands of each and every day. Each person has a different coping style. We all cope with things differently, especially when dealing with different types of uncertainties. Coping styles can be both problem-focused or emotion-focused. So we could be looking at the problem and trying to cope with the problem, or coping with the emotion that the problem has caused. But the uncertainty of illness presents a variety of stressors on the family, right? Some people might be stressed about money related to the illness. Some are more stressed or trying to cope with the loss of independence, maybe. So what would you assess to measure the Chapel's coping process? You would assess how they're handling that day-to-day stress, right? And how this Ian's illness has an effect on their everyday activities. Do they even leave the house? Because it's too difficult with Ian, right? If they're not, then they're not coping well, right? They still need to live their lives. How can you support the Chapels by learning their coping process? Can you tell them that it's completely normal to be frustrated with this illness? Can you normalize some of those feelings and tell them that they shouldn't feel guilty about this? Maybe they have some guilt associated. They feel like it's their fault that he's sick. There are lots of different things that go along with coping. And so understanding where they're at, how they're dealing day to day, if they're coping well, is important to know, and providing support and teaching them how to cope with that is very important. All right, the integrity process. The integrity process of the family life involves family values, their rituals, their history, and their identity. So family rituals provide a useful framework for assessing different threats to that family's integrity. So some of these rituals include like celebrations or traditions, activities regarding like birthdays, religious holidays, bedtimes routines, or even kind of ritualistic, right? I know with my kiddos, they very much are used to me doing the same thing every night with them for bedtime. And if it changes even a little bit, there's a little bit of upheaval there. So role changes may also occur, particularly when this chronic illness or impairment is involved. And so there's, again, some changes that occur, and it breaks up that ritual and those roles. So what are some ways we can assess the Chapel's integrity process, including their rituals and their roles? You can get them to kind of say what are some things that are important to them. What was important for them in the past, before Ian was born and before his illness? What about especially family meals? They might look really different now because Ian can't eat orally. Let's see. What about the roles of the parents? Miss Chapel, Adriana, has become that primary caregiver, right? Did she expect this? Is it something that she thought would be happening now? Some of these expectations aren't what they always seem to be, and it breaks into that role they expected to play. So all of these things fall into that integrity process, and an illness, a change in health status can really interrupt this. So it's important to know what that family dynamic looked like, what was important to them, what is important to them now, and how they can react and adapt even with these health issues to kind of meet their needs. And lastly, we're going to look at that health process. This process includes the health status, health beliefs, and practices and lifestyle practices. So this is assessing the family's definition of health and how they define the health of the individual family members, right? For some families, having a chronic cough and not feeling good is kind of the norm. And for others, if you have a sniffle, that's whoa. We need to take you to the doctor, right? These are different health beliefs, different health practices, different family practices, right? So how do the Chapels deal with health problems? Who do they turn to? Do they wait to the last minute to get help? Are they at the doctor, like I said, at the first sniffle that Ian has? We need to explore their health process and explore their beliefs and things. So these are the different processes for that family health systems approach. Just think through this, because these are the things that affect our families and affect our pediatric patients, and it's important to understand all of these different processes and how they affect our family dynamics and ultimately affect the health of our pediatric patients.